everyone. My name is Dr. Hitesh Lokwani. I am a dermatologist and a hair transplant surgeon practicing in Indore and Jabalpur as well. Today, I'll be talking about our home remedies helpful in reducing hair fall and the importance of family history in hair fall. Hair fall is a common problem nowadays and it depends on several factors, including a person's genetic history, diet, routine habits as well. And these things, they have an impact on the hair fall. Talking about the diet, some natural ingredients which are helpful in treating hair fall are coconut milk, green tea extracts. Green tea extract, they are rich in antioxidants which promote the hair growth, and beetroot juice, almonds, aloe vera, fenugreek seeds. They also help in repairing the hair follicles and in regrowth of the hair. Some dietary factors like high protein diet and high intake of fruit juices and all, they are also helpful in preventing the hair fall. Habits which we should avoid, like do not comb the hair when they are wet, avoid hair straightening things, and avoid putting up chemicals such as parabens and sulfates in the hair care products, and style your hair when they are completely dry. Reducing the stress levels by practicing yoga and relaxation techniques, they are also helpful because stress is a very important factor which gives us the impact on hair fall. The history of the family history is important because either side of the family, if has any history of hair fall, they are related to your history as well. Genes, they are effective. Genes have they get stimulated hormone called dihydrotestosterone, which shortens the growth phase of the hair. Hair follicles, they also become smaller in response to dihydrotestosterone and subsequently produce fewer and finer hairs. Hereditary pattern baldness starts with thinning of the hair and often progresses to complete hair loss and the parts of the scalp as well. It is associated with the pattern and extent of hair fall. Nowadays, we see androgenic hair loss and in the third decade as well. And at least as per the data, 80% of Caucasian men show some signs of androgenic alopecia by the age of 70. Male pattern hair fall is seen more commonly as compared to females. There are 4 factors which depend on the history, which lead to androgenic alopecia. That is susceptibility to age. There are some habits which get us susceptible, like smoking, drinking, and low protein rich diet. They actually stimulate the susceptibility to androgenic alopecia, the age of onset, the rate of progression, and the pattern of hair loss. Hormonal influences, they play a key role as they affect the major circulating hormone is testosterone. That is the major circulating androgen in men. Its metabolite dihydrotestosterone plays a dominant role in androgenic alopecia. In males, we see temporal scalp hair recession, which is a common thing. We also have seen cases where the vertex baldness starts first. It starts with hair follicle miniaturization, which is basically gradual diminution of the size of follicles that results from the transformation of terminal follicles into well-established follicles. And coming to the treatment part, the early we diagnose, the early we should treat it, because hair miniaturization is reversible to a certain extent, and we should start the treatment by consulting our dermatologist as soon as possible, because this will lead to reversing the miniaturization of the hair and preventing us from getting bald. The treatment basically includes minoxidil and finasteride. And thirdly, there are procedures like platelet-rich plasma therapy, which also boosts up the treatment in form of it reduces the hair fall and boosts up the hair growth as quickly as possible. And these procedures are completely safe. The only part is we should comply on the treatment for at least one hair cycle, that is around 9 months, 8 to 9 months, and we should stick to the treatment and don't stop the treatment before consulting a dermatologist. Thank you so much.